Snacking isn't formal, which means no knives and forks. You don't even need to book a table for snacking. In fact, you don't need a table at all. Snacking is comfy and playful. Snacking is a tasty treat. That's why snacking is colorful. Snack with Fanta.
The global population is projected to reach 8 billion on the 15th of November this year, according to the World Population Prospects 2022, released by the United Nations Department of Economic and Social Affairs. The Day of 8 billion presents a vital opportunity to draw the world's attention to the infinite possibilities of humanity to build the world we want, with sexual and reproductive health and rights for all at its core. As the UN's thought and action leader on population issues, UNFPA will mark this milestone by celebrating the advancements in healthcare and a reduction in poverty that enabled humanity to reach this level. Join us on NBS TV this 15th of November 2022 for a talk show under the theme, Ensuring a Healthy and Productive Population in a World of 8 Billion Through Sustainable Financing for Health. Follow the conversation on the hashtag 8BillionStrong.
Good morning and thank you for keeping it NBS television. You're watching the breakfast meeting. This 15th day of November 2022 is one that speaks to a topic we have shared about, that speaks about the 8 billion population. What does that come with? Quite a good thing, but what are the strides that have to be looked into? Where is Uganda as a nation? But worldwide, what should we be thinking about? Where should we be focusing as a nation? We know that the population is growing, yes. What are the key indicators of having a healthy population, one that will have to be productive to all the nations as it comes up? We have a discussion to put a few things across, if not discuss all that it will take for the nations to embrace this population, but also have it with its priorities discussed and enforced, as is. Joining me at the Political Command Center are two ladies to discuss this topic. On my right is Dr. Sentumbwe Olive, who is the WHO Sexual Reproductive Health Personnel. Good morning, Doctor.
Good morning.
On my left
Nice
On my left is Professor Pamela Mbabazi, who is the Chairperson, National Planning Authority. Thank you very much for joining us.
Thank you for having me.
I want to begin home in Uganda.
Yes.
What this 8 billion population serves to mean for Uganda, the resources, the people, and the focus. National Planning Authority has the obligation to plan for this country.
Yeah.
What does this mean?
Thank you very much. Good morning, viewers. I am pleased to be here this morning to talk about what the 8 billion means for Uganda. Dear Ugandans, today we celebrate the 8 billion day when the global population hits the 8 billion mark. And that, according to the UN Secretary General, is meant for us to celebrate humanity and appreciate the need for us as a global community to live together. But what does that mean for Uganda? Certainly, Uganda's population is growing, and we need, as a planning authority, as a country, to really plan well, to think through how are we going to create the right environment for our population to exploit its full potential. We have a huge population that are young in this country. And for the Planning Authority, really, we want to ensure that we challenge our thinking as a country, create that conducive environment where we can grow a healthy and able population that can maximally utilize its potential to promote this country and ensure that no one is left behind. So we want to work together as one Uganda as we celebrate the 8 billion mark globally, that as Uganda we position ourselves very clearly and succinctly to provide a conducive environment for our young people to thrive. And we can do this.
What that speaks to, the 8 billion day, speaks to 8 themes, the 8 billion, and the 8 actions. I want to speak to WHO. One of the key issues, if not many of the key issues that have come equally with the growth of the population, In Uganda, what we would speak to what the teenage pregnancies have looked like, especially with what has come with COVID-19. We know that there have been a lot of school dropouts, but we know still there's still mothers that die in efforts to give birth to life. That speaks to sexual reproductive health. I want to get a perspective of what, for you, the 8 billion means for nations.
Yeah, it is an opportunity and a challenge. I think for the Ugandan population, as you said, we, on the side of health, we see a lot of people with their sexual and reproductive health needs, and therefore the need for the system to provide them with choices, so that really they have the services, the information which they expect from the health system, and that we work as a team multi-sectorally to address some of the challenges we are facing, like what you've just said, maternal mortality. We are expecting that maybe annually we are looking at over 2 million births. That means that our services, sexual and reproductive health services in all the districts, must be ready to receive these women, so that they are properly looked after antenatally, properly looked after during birth, looked after when they deliver their babies, so that we really reduce the number of ill health incidences, and so that they come out of this experience happy. But we are also challenged with the young people, the adolescent girls, who really we know should be in schools, should be growing in homes, but unfortunately they found themselves with a pregnancy, a childhood pregnancy. That usually poses a challenge to the health system. It poses a challenge to themselves and poses a challenge to the family and the community as a whole. So we have an opportunity, though, as multi-sectorally, if we can think about it like that, to put a stop, to prevent some of these challenges and create more opportunities for young girls not to find themselves pregnant and getting out of school, and in fact developing some of the most challenging complications you'd like to think about, and finally dropping out of school and really dropping down to the lowest level of society. So as health sector, we do believe that there's going to be a very big need for the different sectors to work together to enable people to be healthy. Because for us, it takes even eating the correct food.
Yeah.
Making sure you're taking people to school so that they can appreciate information even as you give it. You must make sure that if they want to access a health facility, there are roads. The infrastructure is fine, that there are cars, vehicles to transport them. We need to see people taking the correct amount of water, having the proper sanitation in their environment, because if anything goes wrong with any of those environmentally, then we are going to see sick people. And that's a challenge, because the health system which we have is not yet up to the mark of the 44.2 million Ugandans we have. So we need everybody to be working to prevent ill health.
Thank you very much. Health is a right.
Yes.
And part of the execution's key in this 8 billion day is ensuring health and rights of people. And we want to understand from the National Planning Authority, there's a lot of pressure on resources.
Yeah.
As the National Planning Authority, what and where do your priorities lie? We know that health could be a priority for every other nation and education for them. Where are ones for this nation?
That's a very good point you've made. To ensure the health and well-being of our population, there's need for sustainable financing. And I think that certainly, as my colleague just mentioned, working together as one government, as one country, with our partners is going to be very, very crucial to ensure that we do the right prioritization, because we are going to have to provide the conducive environment, as she put it, that will enable us provide health services at the minimal cost, but ensure that we get it right. What does this mean? And we need to be more frugal and smart in how we deliver our health. And this means concrete planning and ensuring that we look largely, and this is what the Planning Authority is doing, to ensure that we shift our thinking from the curative aspects of health to the preventive. And this will require us to look at the entire environment, as my colleague mentioned, to see, using a life cycle approach from the point a child is born. And even before the child is born, is the mother healthy? Are they able to produce and eat the right amount of food so that when the child is born, the child is healthy and that the child grows up in the right way so that we prevent many of the non-communicable diseases that are affecting us and reduce the burden on our healthcare system. As my colleague rightly mentioned, we still have a lot to do as a country to ensure that we get it right. But the government is trying to really ensure that we work under the program approach, coming together to deliver the right health outcomes. And we are going to need to ensure that every Ugandan is conscientized and sensitized about eating correctly, about also producing for the market. You recall recently, government launched the parish model to ensure that no one is left behind, that we provide some seed amount of support to households at the lowest level to ensure that they are able to produce and improve their well-being and be able to handle and deal with some of these issues of nutrition, of sanitation, of being able to live a decent life. But I certainly want to let you know that at the Planning Authority right now, we have also undertaken a midterm review of our NDP3 to see where are we as a country? What have we been able to do right? What is still lacking? And then rally the entire government and all stakeholders to say this business cannot continue as usual. We need to change our thinking. We are now more, the population is growing, the global population is hitting the 8 billion mark. We need to do things much more smart and be more frugal in the way we prioritize our funding.
For those that could not be able to understand what exactly it means for the viewers, what does the NDP3 speak to and why is it critical to be paid attention to?
So as a country, for us to achieve our objectives of being, to move from a peasant economy to a middle income economy, we are going to need to undertake a number of initiatives. And in terms of our development as a nation, we need to build a critical mass of well-trained and healthy Ugandans to be productive. And what that means is that we need, not just as government, but as every Ugandan, to take responsibility of their health and well-being. They need to eat right. They need to exercise. They need to really ensure that they're earning an income. And we need to take it upon ourselves to really ensure that we become productive and make a contribution to the progress of our society. And this, to me, is what it means as we celebrate 8 billion mark, that we need to celebrate our humanity as a country. We need to celebrate the environment in which we're living as a nation, but take it upon ourselves as every Ugandan. What are you doing to better yourself? What are you doing to live a healthy life? What are you doing to ensure that you continue being relevant as a Ugandan? And I think for me, celebrating the 8 billion day reminds us all to ask ourselves, what is it am I doing to live a more healthy and better life for the progress of our society?
And what your contribution is as a person to the nation.
Absolutely.
Looking into this theme of ensuring a healthy and productive population in the world of 8 billion and sustainable health financing, what I want to understand from here, there is a lot of shift, especially from the global world, and we want to understand from you, Doctor, what the key indicators are, and we want to understand how can Uganda as a nation improve, especially its financing for health and giving it a priority that ought to be given.
Yeah, I think we talk about the health outcomes and therefore the indicators, what shows us that we are progressing in terms of health. Broadly speaking, and coming from the family perspective, you would upfront offload the indicators for child health. How healthy are our young people, especially the newborns? If we start at that level, if we start with the life course approach, we are looking at how many newborns survive out of the 1,000 delivered. We are still high. The global indicator requires us to drop to 12 per 1,000 those who die. But Uganda is anywhere between 23 and 27. And in the rural area, it could be higher because of the unavailability of services close to the people who really need them. We still have mothers who deliver without care of a skilled health worker. And when the baby or the mother develops complications which threaten life, sometimes they die. And so we need to ensure that both the mother who is pregnant and in labor is really in a health facility to reduce the numbers of the newborns and the mothers who die as a result of complications of pregnancy and all its related issues. So those two indicators, the newborn and the mothers who die out of the so many 100,000 delivered, is still high for Uganda. We are still thinking that we could be losing 16 women per day. That's huge if you think about it. Mothers who went in, either they are still pregnant, they develop a complication, they die because that complication could be not managed in time. 16, the number 16 is huge. It could make news if we cared to depict it in the correct way. But I think there is no announcement every day to you to indicate that we've actually lost 16 mothers. It's a whole minibus crashing.
Once.
But there's no news. But that's the level which we are still at, and we need to reduce that. The next issue is our infants below 12 months who survive. That is reducing because, as you know, keeping infants healthy requires a good immunization program, requires good water supplies so that they don't get those diarrheal diseases, requires that we have food to feed them, they don't develop malnutrition, requires that we are preventing malaria, which we are also trying very hard as a country. I have a robust malaria program. So those children below 1 year and those children below 5 years are huge indicators for us, and they are showing an improvement because we are doing all these other programs which I've said. Good immunization program, good malaria program. We are trying to access water, but there are also populations, you must realize, which don't have adequate water and food. Then we come to indicators which show whether we are able to control our fertility. As a nation, we are also not doing very well on that. There are few users of family planning, yet family planning as a pillar could solve a number of problems related with pregnancy. Because if you're not pregnant, then you're not likely to get the complication from a pregnancy. But as a country, both rural, well, slightly better in the urban, we are not using the available family planning services. And we need to step up because this is contributing to big unmanageable families. Unmanageable families in terms of numbers, you can't feed them, you can't educate them, You even can't have a house which can take all of them if you have 8 children, 9, 10, 6, 7, 8. That's huge for you to feed, educate, and give beddings and make sure they develop properly. So as a country, we really want to encourage that taking on family planning. We are still at around 37 there, 38, 39. And in urban areas like Kampala, yes, we could have reached 53% of couples who are supposed to be using. But that's still low if you look at the neighboring countries. So we are thinking that we need to really create awareness, advocate, take services down to the community, and that is also very expensive, community outreaches, but also mobilize men to support their spouses to use contraceptives. Because one of the biggest challenges that women have come with in the health facilities as to why they're not using is that their husbands are not supporting them.
Acceptance has been
They're
hard.
not accepting it. They are facing violence in homes when they take it on without the engagement, without the involvement of men. So we have a culture, we have a religious issue there to solve. Family planning is a huge pillar for development. If we could take it on well and really understand that you don't have to have as many children as probably the eggs are in your body. You can really have a very controlled spacing of the babies you have because it's good for you as an individual woman. It's good for the husband because he also can't catch up with this. And probably that's why we could be seeing a lot of other vices which we think are bad, but we don't know why exactly. Because a person with 8 mouths, 10 to feed, and taking to school is probably going to be a little bit unscrupulous at many other things. Because he will try to put in as much as possible and even want to share what belongs to others. So there are a lot of things we need to discuss around why we need as a country, men and women, to be using, and therefore ensure that our services are facilitated to offer this very important pillar. So there are couples that are not able to have even the services even when they want them. And those are the health systems challenges which we have and which government is trying to address. Are the commodities there? Are the commodities reaching the last man and woman down there in the village? Are the health workers who are well skilled? As you heard from NPA, boss, professor said, are the people skilled to provide the service? Because if you've not skilled them to give the service, then many couples out there will remain without a service which they need. We have challenges of infrastructure. We have challenges of road networks. Are women able to reach us where the services are? So there is also that indicator. So those are 2 indicators related to family planning, contraceptives, which are very important for the profile of Uganda, and we normally track them. So within the section reproductive health agenda population, those are very important indicators for us. But of course we talk about other indicators, our malaria, we talk about TB, we talk about the HIV prevalence, STI prevalences like syphilis. How are we? We had done well, but we are seemingly slipping down. The young people are getting infected with HIV, and we need to always constantly be aware that even within the reduction around 6.97.4, we still have huge numbers of young people. And young people, who are they? The young women, 15 to 24, getting infected. That's a huge indicator for us as Ugandans, and we must keep watch over how it is behaving. So I think those are some of the important things we need to be aware of, not forgetting that we are also a country within the older age group which is catching up with hypertension, diabetics. We have cancers of the cervix, cancers of the prostate also coming up. We don't pick those very regularly, but we must be aware that if the discussion was wider, these are also health issues which we must keep at the back of you.
And that equally becoming a bigger challenge,
Yes.
even in children
Yes.
of young age, and want to
Without
understand.
speaking about the epidemics.
Yes.
You know, sorry to take you back a little bit. I thought that for the benefit of our viewers, I needed to explain a little bit more about the sort of principles guiding our prioritization of health, so that we really appreciate the fact that as a country where we are, and it relates to what Dr. Olive was talking about, we need to focus more on prevention as opposed to cure, and addressing the root causes of what affects the health and well-being of our population as opposed to the curative. And for me, that is how we will reduce the health burden for the country and ensure that we you know, develop a healthy and productive population, because 70% of our disease burden is actually preventable. And for instance, 75% disease burden, of the 75% disease burden, 13% is caused by road accidents, 15% by unhealthy lifestyles, and malaria contributes, of course, 30%. So prioritizing in a very resource-constrained environment, I think, gives us an opportunity to go to the basics. And I really wanted our viewers to understand that as a country, we need to work together to ensure, because resources are scarce, and we need to inculcate that ethos amongst the population, that you need to focus on having a good healthy life, hand washing, hygiene, and of course COVID has helped us to do this. But also, I think that the point I made about using a life cycle approach, where, for instance, you know, when you have a better nutrition health mother, they will produce a better child who will go to school and be better able to learn and be able to deal with family planning if they are educated. So it is a sort of chain, and they'll be able to get married and reduce on teenage pregnancy. So, and it affects you up to old age. So it's important that you know, our viewers understand that as a planning authority, we're really trying to get and rally the country to focus more on the preventive, but also use the life cycle approach that we deal with our health, but also the program approach that we're dealing with in government. And it touches again to what Dr. Olive talked about. It's not just the health or the Ministry of Health per se. Ministry of Water is responsible, because if we need sanitation and we need the roads, Ministry of Works has to ensure that the roads are done. Ministry of Gender has to ensure that the population is educated, and that the Ministry of Education should be training. So we need to work together. And I'm appealing, especially for us in government, to really do much more than we are doing, to really work together, to create the conducive environment that will enable really our population maximize its potential. Now that we realize that globally we are becoming more, and yet resources are limited. And I wanted to make that point.
You speak about the resources being limited as they are, even when the population keeps on growing.
Yes.
The current population alone gives a lot of pressure to the available resources.
Yes.
And that still stretches how the different government programs have to run, how government has to approach the different challenges as they come. True. And we want to know,
yes,
every after 20 years,
yes,
Uganda will have to grow in terms of the population. Sometimes, not all the times, the programs will not have changed.
yes.
Oftentimes, the different services could still be the same. How best can national planning help the country out of that?
Thank you for that. Indeed, Uganda's population is doubling every 20 years. And as the population continues to grow, we have to ensure that our health system holds. And one of the innovations and initiatives we're, of course, undertaking is ensure that we fast track universal health care, to ensure that all persons are part of an insurance scheme that will reduce the cost of health service delivery. And this is in line, of course, with the SDG 3 target. We are, of course, ensuring that the NDP 3 also prioritizes health promotion and prevention, as I talked about, you know, focusing on reduced health. But, of course, also ensuring that we roll out the medical information system to all health centers to support health service delivery in monitoring and regulating, particularly the drug stockouts and misuse of medical supplies is one of our priorities. The revision and improved remuneration of our health care providers, workers, teachers in universities is one attempt and focus by government. You recall His Excellency recently improved the salaries for the health workers in an effort to create the conducive environment that service delivery can be improved. But the main focus really is to fast track our universal health care to ensure that no one is left behind and that we can all access service delivery, especially for the most vulnerable. It is an uphill task, especially with limited resources, but we can work together. We can work together towards ensuring that, in terms of service delivery, the health workforce is motivated, we have access to essential drugs, and that, the issues of sexual reproductive health are handled, as it were. So again, I want to emphasize the need to work together as government, as our partners, as every Ugandan, to ensure that we share this health burden. And one aspect that is going to help us in all this is fast-tracking universal health care. The countries around us have made progress. We've seen that it's working for them and that Uganda can do this. So I think we need to challenge our thinking even more now so that we implement it so that every Ugandan can really access health service and ensure that we really improve our healthcare system.
Thank you, Professor. There are no longer questions. If not, there are not any more questions about the conducive environment that has policies, especially to deal with health, except those that have stalled at Parliament level, that have not come out, like the health insurance scheme. One of the key things we want to understand is whether it would be very important, and why, because it would be very important, why it is key for innovations to be critical in terms of healthcare. Why is it pertinent for a nation like Uganda to look at prioritizing them at a time?
Yeah, as we've been saying, the population is growing, and therefore the needs are also growing. Needs for information and needs for sexual and reproductive health services. So, but the numbers of our health workers are being churned out, but not at the same rate as
we need them. Yeah.
How the population is growing. Neither are our infrastructure growing at the same level. You go and find in most health facilities, women almost littered. The whole floor where you need to do a certain service is full, and all the beds are covered. So we also have people who do not want exactly and who don't need to be in health facilities to receive information. If you think about all the young people who need sexual and reproductive health information, who need various services from us, how to test for HIV, how to test for syphilis, how to test whether they are pregnant, and therefore receive services which they want. They don't need to be exactly in a health facility. But through various digital innovations, apps which are available on their phones, they can get a lot of information. They can use it usefully.
That's true.
Yeah, they can go to pharmacies to access certain medicines which they want or contraceptives which they want with just clear instructions on the app. This is growing in Uganda, and we are very grateful to various partners who are really supporting this to happen. We've seen innovations whereby young people groups are taking services and information down to the very vulnerable populations using, again, phone calls, mobile numbers which can help you do something if you need information around what you have. You can go to the next drug shop and buy a particular medicine to use if you were given the correct information. So that is growing, and it must grow, because people now need to combine both the digital applications with the self-care. People need to appreciate that they have a responsibility, and they can actually do a lot of their own care without necessarily interfacing with the health facility of a health worker or a health worker. So this is growing in Uganda, and we are grateful to the government of Uganda because at least in the Ministry of Health, it has had that governance and leadership and coordinated these applications as they're coming and innovations. So that is being encouraged, and it should grow because of who we are. We need it at this time, at this hour, and it must be supported by all private practice, public, because partnering again with the media houses, with the other partners, radios, people who bring in funds, is going to be important to grow that service area. And it's happening, and government is supporting this to happen, but in a coordinated manner. And so we can only monitor how it is being done. We can only put in place conditions not for it to be abused, because it can be abused. And for some people, they can use information wrongly. So the need, therefore, for government, Ministry of Health, to continue monitoring how is it being used, what successes, what are the things we need to change. Because for everything, you need to keep finding out what is not working and what is working, so that you move it on. So that is happening, and I think that's very good for Uganda going forward to really promote these innovations, self-care applications, so that people can actually access services without necessarily seeing a health worker.
Resources, especially natural, have reduced because of the pressures. Bank of Uganda just last week indicated that probably by 2024, Uganda could be still facing the same kind of economic crisis it has, if not so many measures, especially to deal with the growth of the nation, are put in place. And I want to pick from you, with this at hand, could it be time for the country to think and also have measures implemented, probably to control the population?
I think that is why we really took time to say pillar number one for our health is making sure that we are able to control our own fertility as a person, as a people, as a couple, as a family. Because, yes, for a huge percentage of the Ugandan population, we have the ability to have as many children as we can choose to have. But basically, biologically and scientifically, and being healthy, you must really have maximum, we think, for children, for the health of the individual man who produces them. Because every pregnancy has a risk, and the body degenerates. It doesn't become younger. Each pregnancy you carry, even your biology of the uterus which carries the baby, goes down. So that always must be, people must be conscious that our fertility has implications on our general health. And so we need to control the numbers. Because one family, many families, having many children, is increasing the pressure. The pressure on the food available, pressure on the classes, teachers available, pressure on the health workers that are available. But very important, pressure on the land. The resources we have are not increasing at the rate at which we can have children. Yet, God has given us the ability and the resources to control that fertility. And it doesn't get it shouldn't get out of hand, because we must be able to explain up to the lowest level of a family, wherever they live,
Excuse me.
that the resources we have to use as individuals to be able to develop are not expanding.
Yeah.
And the world, even the people of Uganda's next wars and crises in families will be there because of the land, if we are not careful. And this is coming because we are not able to control the populations we are putting out there. And yet we have the capacity to do that. And that's very important. Understanding that the use of the contraceptives available, first the information going correctly to the young people. Because young people are sexually active, they're not having adequate information, they're not having adequate services, and they're having children. We're having children having children. If a child starts at 15 years having children, and they're going to continue up to the 45 years having children, you are capable of having 20 children as a woman, or 20, or whatever.
True.
But there is a possibility of having sex, but without having children who are not planned for. And that's very important. But that conversation must happen at the lowest level of the families we have in Uganda. And why it is important. Because it is you as a family, mother and father, who are going to suffer if your child doesn't have enough food to eat, first of all.
Yeah.
Cannot grow well, therefore cannot go to school. Even if they go to school, they are going to be number last. So they can never achieve the maximum education level you want them to achieve. But this conversation must go down and be discussed and see how it affects, how one act can actually cause a huge chaos in a given community if we are not careful.
You know, if you allow me to jump into what Dr. Olive is saying, we have to have honest conversations, and we're having these debates currently at the Planning Authority, and want to extend it across, because practically speaking, if you look at the entire country right now, and UBOS recently released the poverty statistics. I'm married in Kabale and come from Kigezi, for instance, where the fertility rates, of course, are high, but also the average households, 7 or 8 people. And the land holding, what Dr. Olive was talking about, is about 0.2 averagely in Kigezi. And you see a household having to ebb out a livelihood out of 0.2 acres of a piece of land is a challenge. And we're going to have to think really deeply about how to help such households to really lift themselves out of poverty. And you compare to other regions of the country, for instance, Roya district, average land holding there is about 12 acres, 12 hectares, and it will arguably take longer for us to think. So fertility issues are something that as a country certainly we need. We're at 5.4 right now. That is the 5th highest in the world, and we need to do something about it.
Many questions for that, especially the population and the resources that are available. Now, what we want to speak about is especially that good quality, the good quality healthcare.
Yes.
But also we know that while we are seeking for the good quality healthcare, there's a lot of limits that certainly come with the financial pressures that people have.
Yes.
And that has become worse, especially with the economic crisis at hand, which we are uncertain about and when it has to come to an end. We want to know what the government plans look like to address that. But also, is it something that, while you're planning for it, is it something that you are intentional to execute?
Thank you. Yes, and I'll still emphasize the fact that at least as a country, as I rightly pointed out, the focus is still more on preventive to ensure we reduce the health burden. Having said that, the key strategy of advancing our at least healthcare system is to ensure that we promote universal healthcare, really, and get our country to have private and community insurance schemes across the country so that we can provide opportunities and options for the average Ugandans. Of course, this also means that we need to work hard, create employment for our people. And this is why, as government, the deliberate move to ensure that no one is left behind, the parish model has been put in place. But there are other initiatives like Emyoga, like youth livelihoods, like women initiatives and revival of cooperatives to ensure that there is that galvanized way of ensuring that we try to help every average Ugandan try to improve their source of income and therefore be able to, address their health needs. But also, of course, the other element to it is working towards skilling Ugandans and ensure that they have the right know-how to sort of, be able to be gainfully employed and therefore pay taxes and feed into the healthcare system. So it is, again, an initiative to ensure that we provide opportunities for our population. And I think what government is also doing is to try and attract investments in this country and galvanize the economy. Yes, resources are being scarce, but we are constantly trying to find avenues that will create an opportunity for our country to provide jobs for our population and ensure that we accord them an income so that they can have disposable income to deal with health issues. So broadly speaking, really in answer to your question, we are focused largely on promoting universal health for people to be able to address their health needs.
And that's the commitment at the 8 billion tune today.
Yes.
That's the 8 billion population, 8 themes and 8 actions. What's the commitment of WHO in a few words?
Well, as you know, the mission, the vision of WHO is to really keep everybody healthy and prevent catastrophes happening to people as a result of disease, and make sure that we can prevent epidemics to devastate countries. And I think for WHO it is very important to ensure that we continue with that as a mandate, keeping people healthy and advocating to partners and government to invest more in the health system, because as you've heard, it requires more. At 44 million Ugandans, we'll need more infrastructure.
Yep.
We'll need more health workers, numbers. We'll need more medicines. We'll need more referral systems. We'll need to make sure that we can count these people. There's data available, which is guiding us in the planning at district level and national level. So that is where WHO invests. And usually, WHO looks for partners, relationships and partnerships to ensure that there is more investment in health. We are calling for more investments in health because we know that the government current investment of 7.5% cannot cater for
the entire population, as it has grown over time.
We need more.
Thank you very much, Dr. Sentumbwe Olive, WHO Sexual Reproductive Health expert. And thank you very much, Professor Pamela Mbabazi from the National Planning Authority as the chairperson. It's a question of more investment. It's a question of intentional investment and also execution of plans as they come, and the different projects of government that speak to a healthy environment, that speak to a healthy and productive population at the 8 billion population of the global world. What we bring you up to speed with now is the geopolitics that is currently happening in Kampala. And what is the key discussion right there? We follow up on what is transpiring.